Hello, this is Dr. Brandt Gibson, and today I want to talk to you about the next step after gait analysis. So you're doing a gait analysis, and as we talked about yesterday, we're evaluating a whole bunch of different things. One of the important things that we're evaluating is your arch height. So do you have a high arch, a Cavus type foot? Do you have a medium, or what some people will say a normal arch, or do you have a flat foot, a pes planus type foot? Today we're going to talk about a Cavus foot, and there's some key characteristics to a Cavus foot. One is you have a very, very high arch, and often will have a very high instep. Typically people will come in with a Cavus type foot because they're constantly spraining their ankle, or they have a difficulty fitting shoes, or they're having pain on the top of the foot, or even can have some of the other symptoms like plantar fasciitis or tendonitis or recurrent injuries to their feet just because of how they're walking. With a Cavus foot, a true severe Cavus type foot, you're going to walk in a supinated position most of your stance, or most of your gait pattern from stance to toe off. You're going to actually walk at heel strike, you'll be supinated, you'll roll supinated all the way out to almost push off, and then you'll pronate at that point. The disadvantage of that is you're sitting on the outside of your foot, easily sprain your ankle. You're putting significant more pressure through the fifth metatarsal than it's designed to handle. You're stressing some of the tendons and ligaments in ways that they are not designed to really do. And that's just from the way you walk. Then you take the next step, you say, okay, I have a high arch and a high instep. You have difficulty fitting shoes because you may get a neuralgia or nerve pain on the top of the foot from the pressure from the laces or from pressure from a strap. And you may say, well, I can't find shoes because the strap goes right across this area and it hurts quite a bit. And sometimes that will even create those dorsal heel spurs, those heel spurs on the top of the foot. Not heel spurs, those bone spurs on the top of the foot that we've talked about. So the idea is a Cavus foot can be really problematic that way as well. And so really what it comes down to is, even though you may not have arch pain or pain in that area of the foot, some of these other pains or some of these other problems that you're having may be because you have a high arched foot and you're having difficulty that way. So what is the option? What are the treatment options? Although there are surgeries that can be done for a Cavus foot type, a lot of times they're unnecessary. So usually what we'll do is we'll say, okay, we want to take your foot and we want to put you in a more neutral position. So instead of sitting in a supinated position all the time, we want to put you in a neutral position so you function like you should, where you land on the outside of the heel and roll to the big toe. The best way to do that, of course, is a custom orthotic, especially with severe Cavus foot types, a significantly high arch, because a shoe's not going to support your foot. Over-the-counter inserts are usually not going to support your foot. If you go get an arch support, typically they will not support your arch because they're not high enough. And so you need something that will actually be designed directly for your foot and put you in a neutral position so that instead of supporting your arch, we're adjusting the way you walk to allow you to function and reduce the chance of ankle sprains, reduce the chances of abnormal shoe wear on the outside of the shoe, or stress fractures on the fifth or fourth metatarsals, or take the pressure off the instep area, the top of the foot, so it's not rubbing as much on the shoes and not getting as much problems there. And ultimately, putting your foot in a better position to truly function like it's designed. So if you have a high arch, it may be something worth being evaluated for to say, okay, is there something I should be doing? This is Dr. Brandt Gibson, and this is your podiatry tip day.